we're going to discuss Anti-Emetics, by Professor Saminat and Kairahanam. This slide discusses the anti-emetics. This flashcard explains through serial number, drug classification, drug's name under the classification and mechanism. Number 1. Name of the classification, anticholinergics, drug's name under this classification, 1. Hyoscine, 2. Dicyclamine, 3. Atropine, 4. Scopolamine. Mechanism of anticholinergics. Anticholinergics block acetylcholine receptors in the vestibular center and within the brain to prevent nausea-inducing stimuli to the chemoreceptor, trigger, zone and the vomiting center. Number 2. Name of the classification, H1 antihistaminics, drug's name under this classification, 1. Promethazine, 2. Diphenhydramine, 3. Dimenhydrinate, 4. Doxylamine, 5. Meclizine, 6. Cinnarizine. Mechanism of H1 antihistaminics, blocking the histamine H1 receptor in central nervous system areas include the area posterior and vomiting center in the vestibular nucleus. Antihistamines have anticholinergic properties that block muscarinic receptors at the same sites and block the nausea-inducing stimuli. Number 3. Name of the classification, prokinetic drugs, drug's name under this classification, 1. Metoclopramide, 2. Domperidone, 3. Cisapride, 4. Mozapride, 5. Itopride. Mechanism of prokinetic drugs. Periphery increases lower esophageal sphincter tone and promotes gastrointestinal motility and gastric emptying. This may be useful to treat nausea and vomiting induced by gastric stasis. The prokinetic effects are through cholinergic stimulation of the upper gastrointestinal tract mediated by antagonism at the dopamine receptor D and 5-hydroxytryptamine receptor 3 receptors and activation of the 5-hydroxytryptamine receptor 4 receptors that are located both in neural and non-neural tissues of the GI tract. Number 4. Name of the classification, 5-hydroxytryptamine receptor 3 antagonists, drug's name under this classification, 1. Ondansetron, 2. Granisetron, 3. Palonosterone, 4. Ramosetron. Mechanism of 5-hydroxytryptamine receptor 3 antagonists. These agents selectively block 5-hydroxytryptamine receptor 3 in the periphery, visceral vagal afferent fibers, and in the brain chemoreceptor trigger zone, C, T, Z and produce an antiemetic effect. Number 5. Name of the classification, neuroleptics, D2 blockers, drug's name under this classification, 1. Clopramazine, 2. Triflupromazine, 3. Prochlorperazine, 4. Haloperidol. Mechanism of neuroleptics, D2 blockers, blocking dopamine receptor D2 in the chemoreceptor trigger zone, CTZ, produces the antiemetic effect. Number 6. Name of the classification, neurokinin 1 known as NK1 receptor antagonists, drug's name under this classification, 1. Apropitant, 2. Fosapropitant. Mechanism of neurokinin 1 receptor antagonists, blocking the action of neurokinin 1 and producing antiemetic action. These agents act centrally at neurokinin 1 receptors in vomiting centers within the central nervous system to block their activation by substance P released as an unwanted consequence of chemotherapy. Number 7. Name of the classification, adjuvant antiemetics, drug name under this classification, 1. Dexamethasone, 2. Benzodiazepines, 3. Dronabinol, 4. Nabilone. Mechanism of adjuvant antiemetics, dexamethasone partly alleviates nausea and vomiting due to moderately emetogenic chemotherapy. Benzodiazepines useful in treating anticipatory vomiting. Dronabinol, it probably acts through the CB1 subtype of cannabinoid receptors located on neurons in the chemoreceptor trigger zone, C, T, Z, and, or the vomiting center itself. Thank you for your attention. Further information, kindly contact profsamiacademy@gmail.com. Disclaimer: this channel does not promote or encourage any illegal activities. All contents provided by this channel are meant for educational purposes only.